There are three major things that people find frustrating about traditional talk therapy or counseling when they're trying to improve their depression or their anxiety. And it's important to kind of be aware of these if that's a route that you're going to choose to go. The first major problem that people tend to find when they get into that environment is that they very clearly seem to get a sense from the professional right away that there is a assumed belief that their anxiety or their depression is something that is likely to be with them for a very long period of time, or perhaps their entire life. In fact, there is a section of therapy training that is called acceptance therapy. It's not necessarily the school from which every therapist operates, but very often this idea permeates across very different schools of therapy, traditional talk therapy or counseling. This idea seems to permeate the ethos very often for a lot of these professionals who genuinely are trying to help, but are coming from the very limiting idea that this problem is something that's going to be with you, the patient or the client, for a very long period of time, potentially your whole life. And when you have the assumed idea that this problem is going to be with you indefinitely or for some period of time, and that really the goal of the therapy is just to minimize a little bit of the pain on the edges and hope to make things a little easier for you to cope with, well, that's a very different goal set than going in with the intention to really uproot this and create a sustainable lifestyle where you do not feel like depression or anxiety is a part of your daily life. I call this the coping versus solving paradigm. And so the coping idea is something that most people who are dealing with these challenges themselves personally do not want to endorse right away. They want to get this out of their life, but eventually they come to the false realization, the false idea that this problem is something they just simply have to learn to accept and cope with. So that's the first major challenge with going through that route. The second major challenge, honestly, is that assuming that the problem is likely to stick around for a long time, if not forever, to some degree, the second major challenge is that prolonged treatment and therapy is necessary in order to actually properly deal with these problems. And I'll share with you that in my years of experience, this is just not the case. It's just not. What that means is if you're doing the wrong thing, if you're not going after the real source of the problem, then sure, you can stay in treatment for years or decades. And a lot of my clients are people who have been in therapy or counseling for 20 plus years, and they are still dealing with the same problems that they did when they first came in. So yes, if you're not going after the actual source of the problem, if you're not strategically going in there like a surgeon to make sure that you can get it out, then yes, you're going to be in treatment for a long period of time. But just because most people do not get their situation handled properly does not mean that that's your only option. Okay? Prolonged treatment is just not necessary if it is the right treatment, if it is the right way to go after the problem. If you do know the right way to go after the problem, then real lasting change can happen within a couple of weeks for some people, and surely within a couple of months. 2 to 3 months is what we have found on average for the overwhelming case of individuals who apply the right tools and processes. So don't buy into the second big problem, that prolonged treatment is necessary. It's just not. Now, the third major challenge that people find with traditional talk therapy or counseling is this assumed idea that your problem is something that's going to be able to be solved biochemically. And if you talk to any individual who has been on antidepressants or anxiety medications, I think what you will find is that not a single one of them actually feels like their problem has truly been solved by going down that route. In our cases, the people we consult with and work with, we see everything from the spectrum of, on the one hand, yes, medication helped me a little bit. It has helped me get through the days a little easier, but my anxiety is still there. Yes, my depression is still there, but the medication is helping me a little. And that's kind of the best case scenario that we tend to find. We've never, ever heard somebody say, yes, the medication I'm on has solved my problem. I've just never, in all of my years of working with people with these challenges, ever heard someone say that. Now, on the other side of the spectrum, you're running into challenges with biochemical dependencies, switching from drug to drug to drug, having physicians that are wanting to change it up, and all the while, the patient or the client is essentially hoping that they're going to hit the prescription lottery and find the magical biochemical combination that's going to unlock some sort of figurative safe in their mind. That does not work. It just doesn't work that way. Even the people on this end of the spectrum who are experiencing some positive effects, very often that only lasts for about 3 to 6 months, and then they have to go back and it's not working, or the side effects are hitting them, and it becomes a real mess. But the bottom line is this: even assuming that you get some positive benefits, and it might even help you get through the days or the weeks, the real thing that I've found is that those individuals, even experiencing that best case scenario, do not generally feel like their problem has been solved. They still feel like they're using a coping mechanism. So again, as you've probably heard me say before, you got to get clear on what your goal is. Are you really, just looking to settle for getting through another day, getting through another week, and holding on to your problem, but making it a little less painful? Great, that might be a good route for you to take. Therapy or counseling may be useful for you because that's generally the type of result that those people get. Is it's a way to cope, a way to vent, a way to get things off your chest, and that's all it tends to usually be for most people. But if you're really looking to solve something, really eliminate things, really overcome depression and anxiety, then you need a completely different process entirely. So before you make any, sincere decisions, get clear on what your real goal is, because that is going to define what kind of outcomes you're actually going to create.